and already a number of participants in our Zoom.
1 minute.
Okay, I need 1 minute for being in live. It's still 1 minute to 3 o'clock.
Okay.
Thank you very much, everybody, for your punctuality and for being here with us. So we had a very interesting morning already, opening roundtables from Digital Health Portugal. They've created the Portuguese digital health ecosystem was live here today and vibrant, with also a keynote address from Dr. Jaime Quezado on innovation. And all these sessions are streamed live in our social media channels, as well as in the University of Porto Facebook page. So anyone missing the morning sessions, you can watch them on the social media live streams. That's there for the record. So without further ado, I have here the clearance from Rigi. We would like to start with a short video for thanking our sponsors on behalf of the organizing commission and the organizing partnership that is created for this summit. It's a global hybrid summit with participants on site and also globally from all over the world. During these next 2 days, we are going to have here a series of presentations and also interactive sessions.
Welcome to the tomorrow of healthcare in the Oracle Cloud.
Be clear for the video.
A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Waiting for the new videos. No, it's not this one. The short video. Okay, we'll solve this. I'm sorry, but in a few minutes, and then we'll be able to have here the prepared videos for this session and later on in the panel. So without further ado, we have here the last minute change in the program, and unfortunately we are living in Portugal a very sensitive period now with the fact of the national budget was for the first time in the history of our country didn't pass, and this is creating a little bit of instability. Unfortunately, Dr. Luís Góes Pinheiro, which was supposed to be here with us, he cannot be here, but his presentation will be forwarded by the Director of International Projects in SPMS, and this is Dr. Katya Souza. She is online now for us and will deliver this presentation. And she has been working since 2018 in the Ministry of Healthcare and is working as a national strategy for health information ecosystem. And she was going to have the first presentation. Katya Souza, welcome virtually.
Hi, a warm greeting to the audience and a special greeting, of course, to the panelists in this session. It is my pleasure to be here speaking on behalf of SPMS that is doing a great work on data governance and on reusing data to improve the healthcare system in Portugal. So I will share my screen to go through our thoughts on the theme that we are that we'll be discussing today. I hope you all are able to see my screen.
We see your screen.
It's shared. Thank you, Katya. Oh, perfect. Thank you.
Okay, thank you so much. So today we'll be looking beyond the horizon to actually see if the next generation of healthcare systems will be data-driven. What are we talking about when we're talking about data-driven healthcare systems? We actually need to realize that we are at a digital inflection point, and that governments and the healthcare system as a whole need to rise to the challenge of actually putting data to work for the public's health. We have huge amount of data. We've been talking about being big data from a long time now, but we all must realize, and that has come to be a huge topic in the latest months, is that we are not able to put data to adequately work to improve the public's health. Actually, the success of healthcare systems' digital transformation will be only built by realizing the promise of big data to transform healthcare, medical practice, and public health, and to make them more efficient by using data. So we need an evolution from a digital healthcare system to an intelligent healthcare system that has higher quality and is able to provide coherent care that is data-driven by them. And how can we build a data-driven healthcare system? We need, first of all, robust data governance. A national healthcare system will only be as intelligent as the quality of the data it holds. And data quality is built on having strong data governance frameworks so that we are able to ensure that we have data that is not only adequate, but has the timeliness and representativeness that we need to improve the healthcare that we have. As such, data governance will actually shape population health and precision medicine in the big data era. So the data governance model that we define today will actually define the healthcare system, the data-driven healthcare system of the future. So we need a strong governance model, either for management, accountability, but also precision medicine and public health intelligence for a next generation NHS. We need data governance to address the still fundamental challenges of universal coverage, quality of care, and the financial sustainability of our national healthcare system. To do so, we actually need to use data to leverage the healthcare system focus towards the fundamental principles of health for all and primary health care. So we need to shift the focus from only personalized treatments and be able to put the focus on the fundamental challenges that we face to actually use data to improve the public's health. And that is building an adequate data ecosystem to anticipate the IA-backed operation of health information systems. So to have a digital healthcare system that has intelligence, IT services that will actually add value to medical practice and public health intervention. And we need to do so by having strong core values. So our national strategy at Portugal and in SPMS is based on 4 core values. The first of all is maintaining the public's trust. So we need to be sure that we push forward the use of data within healthcare, but are able at the same time to maintain high levels of trust, especially around governmental agencies when reusing data. The second pillar is having high quality data. Reusing data for healthcare improvement needs a circular process of data quality assurance that it's built within the data governance models. It also needs multidisciplinary teams that are able to select high quality and relevant health indicators that actually transform the data into useful public health measures. The third pillar is to have efficiency. And how can we achieve efficiency? We achieve efficiency through interoperability and a smart system of data warehousing and sharing model. We need interoperability to make sure we have smart inference chains for knowledge generation. And the fourth pillar is innovation. So innovation and data-driven innovation will be a major objective of the next generation healthcare systems. We need to have innovation by transforming the information systems that we have into simplified user interaction platforms. And at the same time, we are able to build an data ecosystem for the operation of artificial intelligence-backed models of care. So what are the key areas to achieve a data-driven health system? And what can we see if we look beyond the horizon? We can see a trusted environment for data reuse while endorsing the Health for All foundational values that underpin the development of the national health system in Portugal. And which key areas are we talking about? Stakeholder engagement. It's the first of all. We need to have health professionals and citizens on board when transforming the model of care by using data. Second, we need a strong legal and ethical framework, and we need to place the focus on advancing prevention-oriented analytics by shifting the main focus that is generally placed on data for personalized care. We need to use data to enhance traditional public health surveillance models into national public health intelligence ecosystems that will prepare us for the next pandemic. And we need to establish a culture of innovation and collaboration. So what are the backbones, and to finalize my presentation, what are the backbones that SPMS is basing its secondary use of data while preparing our country for a next generation of care and of healthcare systems? First, a robust governance model. We are trying to build a health data governance model that is strong enough to make sure we have a seamless process to free data for knowledge generation, but at the same time, while ensuring high level of commitment to cybersecurity and data protection. Second, we are having a customer-centered approach and making sure that the citizen and citizens' needs are at the center of the models of care and at the center of data reuse to support new models of care. Third, as I was also focusing on when talking about the governance model, is privacy and security. But for us, it is actually a fundamental part of the robust governance model that we need to support next generation healthcare systems. And of course, interoperability and use of new data sources. pandemic actually showed us that we are being very slow in upscaling the use of new data sources for health planning and public health surveillance. And a strategy to transform big data into smart data really needs to make sure that we are using and are technically qualifying new data sources as trusted sources for public health surveillance. And last but not least, making sure that we have a focus within our national health system in research and development, and that we are committed into an innovative and research-focused environment around the National Health Service that is able to create a streamlined process, a pipeline for data reuse in the transformation of the models of management and of care in our NHS. So these are actually the backbones that we are building our strategy so that we look beyond the horizon and we see a national and a next generation healthcare system that it's data-driven. I'm also looking forward to hear what are your thoughts on when looking beyond the horizon on the reuse of data for transformation of health and care. Thank you very much.
Thank you so much. A round of applause, please, to this presentation. And I hope that, Katya, you can listen the applause here and the human touch here in this physical space, as we are in a hybrid meeting. And it's wonderful to have this connection, even though at a distance. Thank you so much for your presentation. So please stay around so we can have listen to some more answers. I would kindly ask our Zoom team to put in the spot at Dr. António Pereira, from CEO from the Hospital of the Clínicas in São Paulo. And hey, welcome so much. Dr. António Pereira will deliver his presentation in English or in Portuguese?
In Portuguese.
Portuguese.
I feel, yeah.
Okay, so I kindly ask our Zoom team to be prepared for the translations in the channel of English channels, with speakers will be able to check this simultaneous interpretation. And just to leave a little bit of Dr. António Pereira is the CEO of one of the largest, if not the largest, hospitals in South America. They are having here a world recognition from the Health at the Forum Global Hybrid Summit 2021, one of the global shapers in the, that we are going to recognize from Hospital of the Clínicas in the University, the Faculty of Medicine of University of São Paulo. So it's pretty, almost I would say, a sister organization from this one here, because it's also here, we are in the Faculty of Medical Medicine in the University of Porto, so there's a brotherhood from the Portuguese language in these two organizations, sharing obviously this interest by cutting-edge innovation. And we are eager to hear your presentation. That will be in Portuguese, so I kindly ask if our in-room participants, if you have the chance to connect yourselves on Zoom, you'll be able to listen the translation on your Zoom app, for instance. If you put the channel English, you'll be able to listen to the translation. Remote participants, you are okay because we have simultaneous English interpretation. And Dr. António Pereira, the floor is yours. Tenha bondade.
Thank you very much. Congratulations on the presentation for Dr. Cátia. It's wonderful. I'm very proud about the can represent Hospital das Clínicas, Brazil. That's okay. I take my presentation in.
Hi, Antonio. We are preparing your presentation as we speak. Please start. Okay. And I am sharing my screen in 2 seconds, so just start. Okay. Thank you.
Thank you very much.
The presentation is being shared.
Okay.
Do you see it?
Okay.
Yes, we have it here.
Yes.
Can I change the slides? Or you?
I will. Just tell me when and
Okay. Next, please.
yes.
Essa é uma apresentação sobre os dados, mas acho que é importante a gente colocar o que é o Brasil, né, dentro do mundo, e também o Hospital das Clínicas. Nós temos uma área de aproximadamente 8,5 milhões de quilômetros quadrados, uma população de 212 milhões de habitantes. Importante citar que nós já temos aproximadamente mais de 120 milhões de pessoas vacinadas dentro com a segunda dose. Nós temos um PIB de aproximadamente quase 2 trilhões de dólares, uma população urbana de 87%, um Gini, o índice Gini de 53,4%, uma expectativa de vida que cresceu muito nos últimos anos, e nós já estamos atingindo quase 76 anos, um índice de capital humano de 0,51, uma população hoje, nós já temos mais do que 65 anos, quase 10%, isso é uma das coisas que nós vamos estar trabalhando, e eu acho que os dados vêm para isso, e uma taxa de mortalidade infantil de 12,4%. E nós temos um gasto total com saúde que se aproxima de quase 10% do nosso GDP. Próximo. Os princípios do Sistema Único de Saúde, acho que é importante citar que é o maior sistema de saúde, o Sistema Único de Saúde é o maior sistema de saúde do mundo. Nós temos 3 níveis de atenção: promoção de saúde, prevenção, que é atenção primária, secundária e terciária. A universalidade à saúde é um direito de todos, o Estado tem a obrigação de prover a atenção à saúde. A integralidade, atenção à saúde inclui tanto os meios curativos quanto os preventivos individuais e coletivos. Temos a equidade, todos devem ser igualdade de oportunidade em usar o sistema de saúde brasileiro. Importante também citar nesse ponto que nós também temos o sistema de saúde suplementar, que ele representa aproximadamente 25% de toda a atenção. Próximo. Assim, rapidamente, é uma instituição que foi fundada em 1944, o HC é composto por 8 institutos, Instituto Coração, todo no mesmo complexo, são mais de 600 mil metros quadrados de área construída, nós temos aproximadamente quase 3 mil leitos de alta complexidade, nós temos 62 laboratórios de pesquisa médico, centro de atendimento, e temos também a faculdade de medicina, que é totalmente ligada ao Hospital das Clínicas. Então, Instituto Coração, Instituto Câncer, Instituto de Radiologia, Instituto Central, Instituto de Traumatologia e o Instituto da Criança e Adolescente. Próximo. Acho que é importante também colocar uma das principais características da cultura organizacional do hospital é o seu pioneirismo, apoiando as conquistas na área da medicina desde a sua criação, tanto a nível nacional como internacional. Serve de referência, inclusive, para outras instituições públicas nos avanços necessários em favor da saúde. Rapidamente, de 68 a 2016, nós temos o primeiro transplante na América Latina, o primeiro transplante de coração dentro do país, temos o primeiro implantação self-cardíaca em 1993, e nós temos também o primeiro transplante de rim dentro da febre amarela, dentro daquele período de febre amarela no mundo. Próximo, por favor. Só para colocar assim rapidamente, as internações hospitalares que acontecem dentro de alta complexidade, ou seja, nós estamos falando de transplante, doenças críticas, toda a parte de diabetes, nós representamos dentro do Brasil 8,2%, dentro da cidade de São Paulo, nós representamos aproximadamente 41,5%. Isso representa, nós estamos falando de aproximadamente mais de 2 milhões de consultas ambulatoriais. Próximo. A inovação e a saúde digital, onde nós vamos estar entrando, né? Os conceitos de inovação e saúde digital ganharam um papel importante. A gente sempre teve 3 pilares dentro dessa instituição, que era ensino, pesquisa e assistência, e desde 2000, dos anos de 2000, a gente tem um outro pilar chamado inovação. Destaque, e durante, principalmente, a pandemia, nós tivemos um ganho exponencial dentro da saúde digital. Elas se tornaram muito mais perenes dentro da instituição, inclusive com relação à regulação de telemedicina, teleconsulta dentro do país. A inovação atravessa toda a gama de processos e pessoas com uma necessidade incontornável de sobrevivência. Eu abordarei um pouco a seguir com a proposta atual do hospital e alguns exemplos práticos que foram implementados durante a pandemia e que servem como legado institucional. Próximo. Ou seja, a inteligência de dados, transformação digital, ou seja, nós acreditamos piamente aqui que não tem como você continuar fazendo a saúde do modo que fazíamos anteriormente. Se nós não mudarmos o conceito, nós não conseguiremos chegar numa próxima jornada. Então, assim, de inteligência de dados, ou seja, o que nós estamos trabalhando aqui muito, a coleta de dados, a limpeza dos dados, identificando parceiros e fazendo predições. Próximo. Outra coisa importante que aconteceu, nós criamos uma plataforma de inteligência dentro do hospital. Qual é uma das coisas? A gente tem tempo real, transporte de massa de dados em um ambiente transacional para um ambiente analítico, visões e dashboards dinâmicos de forma rápida e flexível, conectados ao sistema de Sync Sign-On dentro do hospital. Isso faz com que nós tenhamos, não apenas, como a gente sempre comenta, ou seja, informações gerando conhecimento. Próximo. Uma das coisas que aconteceu que foi extremamente importante foram algumas parcerias que nós criamos aqui dentro do hospital. A mais recente se ampliaram com a participação do HC, junto no programa de Better Health, com o governo britânico e o National Health System. Veremos os ganhos reais e potenciais para o sistema de saúde como um todo e, consequentemente, para a população brasileira. Ou seja, a parte do HC foi o desenvolvimento, implementação, disseminação de soluções. A parte do Brasil, o beneficiário, facilitador e validador das soluções. O governo britânico, financiamento e gerência e supervisão das soluções. E o parceiro EMEA, parceiro estratégico com expertise e direcionamento técnicos às soluções. Acho que uma coisa dessa é importante, que todo esse programa que está acontecendo, nós estamos indo na jornada do paciente, da atenção terciária à atenção primária dentro do Brasil. Estamos com algumas, nosso país ele tem mais de 6 mil municípios, 26 estados e um Distrito Federal, e nós estamos hoje implementando algumas ações já de telemedicina, teleconsulta, e eu vou falar um pouco mais à frente, principalmente de tele-UTI, que tem dado um resultado muito prático e mostrando dados extremamente controláveis. Próximo. Qual é o objetivo e oportunidades e metas? Uma, melhorar a experiência do paciente, aumentar a resolutividade e prover acesso. Esse é um dos grandes problemas do país. O sistema único é muito importante, mas ainda temos uma carência em atender o paciente na ponta. Aumentar a capacidade da rede de saúde, nós temos que trabalhar em rede, nós somos um país de dimensões continentais, transferir o conhecimento e ferramentas digitais em todos os níveis. Nós temos uma dificuldade, ainda temos que criar essa cultura digital para todo o país, ou seja, São Paulo é uma coisa, Minas Gerais é outra, são grandes centros, mas quando a gente vai para os quinhões do país fica um pouco mais complicado. E criar soluções e preparar as pessoas, criar capacidade institucional para implementar a inovação de serviços dentro do sistema público. Próximo. Algumas iniciativas que nós tivemos em curso. Rede sem fio, mobilidade e IoT, sistema de Wi-Fi global, com base na incorporação de tecnologias, processos, tais como monitoramento de pacientes, por meio de aferição digital, integração e dispositivos móveis. Central de monitoramento de sinais, central de enfermagem híbrida para coleta de dados, monitores em UTIs, incluindo a possibilidade de ser acessado por dispositivos móveis e telefones celulares. Próximo. Algumas coisas que aconteceram, coisas práticas. Eu tentei trazer ações que aconteceram dentro do hospital. Por exemplo, o laudo de imagem por inteligência artificial. Quando nós tivemos na pandemia, isso foi muito rápido, existia os testes de Covid que davam falso negativo, mas pacientes tinham o Covid. Como, mais uma vez, como eu falei, o país tem dimensões continentais, nós temos uma série de interpretações de exames de tomografia, de raio-x, e nós conseguimos fazer com que esse segundo laudo fosse dado quase em tempo real. E o suporte para hospitais dentro do estado de São Paulo e dentro do Brasil, para a UTI, dando como segunda opinião com especialistas do time do HC, aumentando a resolução de casos extremamente complexos. E o intuito disso tudo, o que a nossa missão é fazer o melhor para as pessoas, com as pessoas. Eu vejo que, como vocês colocaram logo no primeiro momento, os dados, para onde vai, eu diria que a saúde ela não tem como ela não continuar fazendo o que nós estamos tentando, e acho que o mundo inteiro está fazendo. Ou seja, a saúde ela não tem preço, mas ela tem um custo muito alto, principalmente para o sistema público. Queria agradecer mais uma vez, e um orgulho poder participar e dividir um pouco do que o HC e o Brasil está fazendo. Obrigado.
Thank you so much. Now it's a pleasure to have your presentation, Dr. António Pereira, and I hope that you can stay around also to learn and see from other presentations in the floor now. So I think I will be able to call, since we have a hybrid room here, all the representatives and persons from ASCOM to please come to the table and join Jeannine, the CEO of ASCOM, and as always, a round of applause for the presence of our in-person speakers, please. And also, if you want Carlos and anyone else from ASCOM that is here to be in the table, it's an presentation for persons that you can reach during the summit, and also, of course, for the other guest speakers today in the dinner, that we can all interact together. Dr. António Pereira was willing to come in presence. I know that he and Marco Bego was trying to be here also with us. Unfortunately, they couldn't attend us. So in the table and with me as now is Jeannine, the CEO of ASCOM, is going to do a presentation, but also in the table, Carlos Chaim is the director of ASCOM France and Iberia. And it's really great to have you here with us inside. And Jeannine, over to you now, the presentation. The floor is yours if you want to make it from here.
Thanks a lot. Do I press or?
You have here for Brett. You want to present it from here, maybe?
Yes, I can. No problem.
And this
Thanks
is,
a lot. Thanks a lot. So welcome to everybody. Thanks a lot. I'm very happy to be here. And as you can hear in my accent, I'm not Portuguese and not Brazilian. I'm basically Swiss, and that you can hear quite well. I will do two things. First of all, I will have a small, very small intro. What is ASCOM? Because in Switzerland, the brand is known by everybody because they used to produce phones, you know, but it's 40, 50 years ago. So everybody basically knows what the company is all about. Now it's more in the direction of solution. However, what I want to try to show is how passionate we are about the healthcare of the future, and also how we make use of health data. Now the next, do I have to press again? No. Now. Good. So if you look at ASCOM, ASCOM is a global healthcare technology solution company, and it's, you know, global always means like big and heavy, and it's not at all. We are concentrated in really doing this kind of innovation, and then together with partners implement in all the markets where we are. That's making us very fast sometimes, really innovative, and also quite agile. We do have around 260-70 million euros revenue. That was 2020. All know that this was the year of the pandemic. We have 18 operating business, means like with local presence in countries. We are in over 53 countries where we have installations. ASCOM is a stock listed company in Switzerland. That's kind of an important fact if you want to understand how we function also as a company. We have around 1,300 employees worldwide, and as you can hear also in my accent, we are based in Switzerland. So a global presence with a large installed base, and you see all these famous hospital brands there, is giving two advantages. On one hand, it's a very large installed base, which is providing us in parallel with information that we can reuse again to do innovation. It's also bringing the expertise of the best people on board, means like that in parallel we really can work with this kind of expertise worldwide, and this is bringing brilliant minds together. That's important for us, and it's from Australia, all around the world, the US, Europe, also Asia is helping us a lot with the expertise. But let's jump into what ASCOM's solution framework is. Our framework has basically 3 segments because it's a solution you can use in 3 different fields. It's mainly acute care, and that's the largest area. It's long-term care because, as you know, in some areas worldwide, long-term care and acute care is basically always together in one campus. That's in Asia mainly the case, in Europe mainly separate, somewhere in the US, for example, as well. Then we have quite a substantial part of enterprise business wherever critical communication and collaboration makes sense. So the solution means that we bring software as a core and add the services to the software, and that's making us very, very successful in the whole the whole management of alarms. And that's the very important thing, because if you look at how we work with data in the healthcare area, in the beginning everybody was saying, yeah, data is kind of like patient records, it's information, but it's not only information, it's a lot of alarms that we get over sensors, but it's also that we define bandwidth until where a sensor can measure a result, and that all together with some of the dimensions like time, like the mass of the data, is bringing us in the end to the solution, and also kind of like alarm management that is more than just pressing a button and having a light on the other hand. So how do we make use of this kind of data? And that's very important, because a lot of that is, as we heard before from our colleague from Brazil, but also from the first speaker, it's a lot that is nearly real time, you know, because real time, you do know this already from your youth, it's really not possible, but it is near real time. It is very stable, and it also provides information in parallel. And that's what makes us not only ready and read the stuff, but also analyze it. So we react on one hand, but on the other hand, it's providing us all the information we need to really analyze and making things better in the end. So data comes with the information, the alarms, there is the pure volume of the whole thing that you take information out, and it helps to manage and also delivers basically a lot to orchestrate operations in a hospital. That's on one hand, the information is very, very important in parallel, stationary, but also mobile. And that's kind of an important fact that you always have to see. As more as you can make things available mobile, as more you kind of not paying people for running around, but for really taking care. And that's gaining efficiency as well with that. So if we look into that, and we were hearing it before, it's going into the area then also of artificial intelligence, but I will provide some more information to that later on. So if you look at an example that we have, there is a healthcare center in Naples that is a grouping of 10 different hospitals. It's an area that's covered, is one of the largest in Europe. It's 1 million overall population managed. And what they had, and that's the actual case with the pandemic, they really had to change their way of how they were thinking. They had to remove pressure from hospital, but also monitor patients from home. And it was very, very important that in the principle, whatever we used as a solution must be for patients very easy, means like plug and play. So if you provide something and you need kind of like a group of trainers that are helping patients to come up to speed, then you fail with the solution, because then it's not very user friendly. So so they managed to do that and really had a very nice effect. So what was the customer case there? There was a solution package, as I said, plug and play of wearables and ASCOM smartphone. There was a specific smartphone with that. It is a Myco 3, that's the product name of the thing, for the surveillance at home. And why is this important? Because you could say that maybe 98% of all the people, they have their own smartphone. But believe me, if you have to teach people how to install an application and then really being sure that it also works, then you have some of the, not only physical, but also some of the hurdles that are too high that you really can do kind of plug and play. So there was a collection of vital data in near real time. Data was recorded directly to patient's health record and also to a cloud dashboard for the patient overview. And that's very important, the clinical decision support system CDSS to assist the caregivers in taking the right decision based on the rules that were defined before. And that's very, very an important thing. And we have some other cases in our company, like, for example, in the Netherlands, where they used this kind of system, even doing pre-knowledge of so-called infected COVID patients, and they could start with the care very early, and they really could prove that the death rate went down. So the goal was also to move towards proactive care as well as care for home. And that's something where we know that in many, many countries, the decision or the discussion is going on. How can we really take care for people at home as well? Because there are also studies that people recover sometimes faster when they can be in their used environment. So, in Naples, they were very, very proud on that solution. And there is a statement from Ingegnere Giro Verdoliva. I hope I really pronounced this in the right way. I have a colleague from Italy here, and he has thumbs up. So the statement is, digital technology not only includes the digitalization of data, but also the ability to support doctors and health workers in the adoption of clinical and organizational decisions. It contributes, therefore, in a concrete and fundamental way to the digitalization of hospital and healthcare structures and to the development of the concept of healthcare 2.0. That's how they call this. And it is very important that we also see that the fourth wave of digitalization, where it's more about really the use of data and how we make most of effect out of it, is seen as a wave that is taking with the digitalization all the staff of a hospital as well, because there is nothing you really can save, but what you can do is making their work more effective. And that's very, very important. And there we also want to be a part of. So if we want to do an outlook into the future a bit, but it's the future that is already kind of in the presence, it's using innovation as a lever to exploit the full potential of health data. And that's the aim basically also of what we were doing. So it's kind of next, but it's already today. And we heard it before, it's not only a buzzword. Artificial intelligence is a tool for improved clinical decision support system. And what is very important, artificial intelligence, you never would apply a machine that is learning right in treating patients. But what artificial intelligence is doing with gathering the data, collecting data, and giving us hints for the right algorithms, it's really improving not only diagnosis, but also therapies, and is increasing the speed in decisions. And that is giving then the perfect orchestration. And this is really improving healthcare, not only with technology, but also with having in parallel different things where you can act. So that's important to see, and it is also something you can easily explain also to patients, because then they understand a bit better why all these kind of data is important to really, really be successful in the future. To finish the whole thing up, I brought a video, and I hope this...
Sometimes it's hard to come home and act as if you didn't just witness something life-changing. Because you did. You were part of a critical moment in someone's life. And it makes me wonder, why is this my choice? Why am I a nurse? I know I can't change the whole world, but I can change it for one person, even if it's only for an hour or two, by being there when it counts. Nursing is a process. Assess the patient, implement care plans, get the right people together. Heart rate 115, temperature 38.5, saturation 88. Could it be a surgical site infection?
Get infection parameters. I'll be there in 5.
And technology enables just that. Connect with the colleagues, access and share information, prevent documentation errors, stay by my patient's side. It means I can do a little bit more for my patients.
Hi, Michael. You have problems with your leg? Send him to ICU.
And I get to change their world.
Hang on, guys.
And I just know.
Thank you.
This is what I'm meant to do. That's why I'm a nurse.
Thank you. Just last to me to thank you for your attention, and hopefully you are now also interested in having some more information about our solutions. Thanks a lot.
Thank you so much. It was one image tells 1,000 words, the video tells 1 million. It's even better. So it was great. Thank you so much to the. You can stay in the table because it's no way for, or unless because you have the chance to view in the next presentation will be from Licínio Kustra-Mano from the European Commission. Licínio, it's so good to see you virtually. So sorry that you cannot be here with us in Porto, but virtually will be also good. Welcome to the Faculty of Medicine in Porto University Auditorium. Your presence now is being seen here to the number of participants that are here and also for our dear participants on Zoom. The floor is now yours, Licínio.
Boa tarde, Portugal.
Boa tarde.
Boa tarde a toda a comunidade de língua portuguesa e estou certo que em breve iremos conseguir estar mais juntos, mais próximos e bem mais unidos. Para já vou passar para inglês e fiquemos pelo online. Today I'm here to give you some exciting news about the European health data space, how it is progressing. It was not so long, well, a lot has happened. In 2019, Commission Kyriakides announced the European health data space as a top-level flagship initiative from Europe. And that ambition was to a data space to promote health data exchange, in particular to support research on new preventive strategies, as well on treatments, medicines, medical devices, and outcomes. And in the middle of that ambition, there was this principle that citizens should have control over their own personal data. This was 2019, the ambition was high. But 2 years after a pandemic, a worldwide pandemic, I believe that we are almost all convinced that we need to make better from our health data. So the first thing we need to acknowledge as well is that health data is not alone, meaning what? Meaning that when we speak about building a data space, we also need to understand that the power of data is when combined data from multiple patients and as well as when combining data from multiple sectors. Imagine the power of health data combined with the agriculture data, with environmental data, energy, and also with the financial data. So our challenge here when we're building the European health data space, yes, is to address the specificities of health data, but not lose track on what is happening in the other data spaces. At the same point, when we start looking inside healthcare and health data, we know that there is a coin of two sides. There is the use of data for healthcare purposes, for directly treating a patient, and we generically call this the primary use of health data. Then there is the secondary use or reuse of health data that we call when we say that other stakeholders like policymaking, regulators, researchers, companies, the type of use they give to data is different. They use the data that was once collected for primary use, for healthcare purposes, and they use to make new things, research, policies, new products. So we need to be also careful, mindful about this. And in our path, in these last 2 years, we have encountered several issues with health data. And we try to bring here at least 4 of the main problems we are finding. And they are around data access. So the first one is cumbersome individual access and control over their own data. And this is even worse when it talks about cross-border health services. What this means is that whenever you, me, each one of us, when we need to have access to our health data because we need to go to another country, we need to go to another hospital, to another organization, and we want to take our data and present to the new document, we have difficulties in doing so. Sometimes it's given on paper, sometimes it's given on PDF, but it's really in an Europe-wide scenario we need to face with multi-language. So there is a cumbersome access and control over our data as citizens. The other part, one other problem is for providers, like the ones we have been seeing in the Health Data Forum. The providers of digital health services and products face barriers and additional costs when entering markets, meaning entering another member state. So if you tailor your solution to the legal context, to the interoperability context of one country, you will face issues and difficulties entering in the interoperability context of another member state. Is that the Europe we want? Well, it's not. If we want a free movement of data and services, we need to ensure that interoperability is not a barrier, or at least the lack of interoperability is not a barrier. The third point would be that we need to acknowledge that we are seeing limited innovative health services and products that are based on health data use, so data-driven innovation. Why is that? Most of the time is because it's really difficult for actors like researchers, policymakers, regulators, companies to have access to health data, because that data was collected for primary use, for healthcare purposes, and the barriers are very high in order to keep that data safe. We are lacking a safe way, a secure way to make that data available for this secondary use. Third, in the same line of thinking, policymakers facing also difficulties in accessing healthcare in order to redesign policies, to redesign how health services, health systems are organized and delivered to the citizen. So we took these 4 problems and we are trying now to bring forward a legislative proposal also aligned with these 2 sides of the coin. So looking to the first side, the primary use of health data, we are trying to create this legal platform where we can expand the rights of citizens to access and the portability of health data. So imagine a world where you as a citizen, independently of the hospital where you go, you can have your data, you can bring your data to you and allow access to your data to any other health professional that you want. Continuity of care, being inside of a country or a cross-border scenario. We also are looking to strengthening the position of the e-health network, the European network of member states that come together and try to make interoperable possible between the member states. By strengthening, we need to clear that today the e-health network works on a voluntary basis, and we are trying to look for ways on how some of the health network guidelines can become with binding powers. The My Health ATU, for the ones that are familiar, I will speak a little bit more on this. It's a service that allows, when you go from Portugal, travel to, for example, to Italy for tourism or to live there and work there, imagine that you need to go to a hospital or to a pharmacy. The My Health ATU, as you'll see, allows you, when you are outside of your home of affiliation, country of affiliation, to allow the health professionals there in that country, the country of treatment, to have access to your patient summary and e-prescriptions. I will speak about there a little bit more about that in this presentation today, about the My Health ATU. And last but not the least, the interoperability of health software solutions like electronic health records, apps, medical devices. Each country is developing, each member state is developing its own interoperability framework. And as we identify, this is an issue because it acts as a barrier when you try to develop a solution here in Portugal, then you need to develop in Spain, then in France, then in Germany. All these standards that are used to ensure interoperability, if they are not common, if we don't have a common way of doing it, it will create a barrier to free movement of products and services. So you can expect that in the legislative proposal for the European health data space to see provisions for these directions regarding primary use of health data. Moving to secondary use of health data, we are focusing more in strengthening the legal basis for the reuse. So you remember the secondary uses of health data. Why is that? We have the general data protection regulation. For sure, it protects data and gives a lot of citizens' right. The question is, there is also different ways on how GDPR has been interpreted and applied in the member states regarding the secondary use of health data. So what we are trying to create is bringing clarity and bringing a common way, a common framework in which organizations in the countries that are tailored to allow access and authorize access to health data for secondary purpose to have a common European ground to work to base their decisions. At the same time, we know that about data that if you put garbage in, garbage out. So we need to find ways to ensure interoperability and data quality or data utility. How to bring transparency to that? We are looking to ways on creating a framework about to have a common understanding on what quality is, and imagine that you could measure the quality of a source of data, of a data product. And with that, when you promote your data product, you can actually say, I'm here in the scale, I'm here in the label, this is my level of data interoperability. And at the same time, it works as a roadmap if you want to increase the quality of your data sources. So promoting interoperability and data quality transparency. We are also we know that there is a tremendous capacity already, namely by research infrastructures already established in the countries. And this because there is a lot of activity cross-border level. But there is a new reality where member states are realizing the value of health data and are putting in place what we call the data permit authorities or data authorization bodies. And these bodies have this function to assess requests to data and put in place scientific committees, ethical committees, and safeguard that the use, a protocol, a study can have access to a certain amount of data, and that will do in order to secure the outputs of that data, that this data is not leaked and that it's not abused in terms of privacy of the individuals represented in that data. And in order to accomplish, also to make this a little bit more tangible in terms of how this works in a European scenario, we are looking at introducing a European infrastructure for secondary use of health data. So let me walk with you for 2 more minutes on the aspects of infrastructure. The first one, it's already in operation, so it's a reality. And by the way, congratulations to Portugal for being one of the first countries in Europe to have the 4 services available through this infrastructure. Congratulations, Portugal. It's really a pleasure, and especially if you are a citizen living outside Portugal, this is really important. So what is the use case here? So imagine the following. This is the reality. So in each country, in each member state, there is a national contact point. And in this national contact point is an entry, it's an entry door for what you will see. So I'm starting here at the bottom right. I'm a health professional, a doctor or a pharmacist, and I receive a patient, a citizen from another country. So we are here in the member state of treatment. And so we are in Belgium. We receive Licínio in the hospital in Belgium. Licínio is Portuguese. So the health professional asks Licínio, what is your medical history? So do you have any allergies? Which are your vaccines? Do you take any medication? Do you have any medical devices with you? So there is a lot of questions in order to build a history from Licínio when Licínio gets to an emergency situation in a hospital in Brussels. So what happened is that through the My Health at EU or through this infrastructure that you see here, the health professional in Brussels, in Belgium, is able to ask Portugal, the member state of affiliation of Licínio, to give them the patient summary of Licínio. This is the combination of the most essential information from Licínio. And there it goes. So information goes in an interoperable format that is able to be translated and presented to the health professional in Brussels, in Belgium, in the language preferred, French, Dutch, or even English. And that's how the EHDS1 infrastructure, the My Health at EU infrastructure works, connecting countries and allowing health professionals and in the future as well patients to have access in a cross-border scenario to patient summaries, e-prescription, and in the coming years, it will be also be for laboratory results, image and reports, and discharge letters. So it's a growing infrastructure. Once again, congratulations, Portugal, for the pioneering position in this infrastructure. The new infrastructure that is concept, and this will be piloted in a project that the Commission is launching. So today in the Info Day for the EU for Health program, we launch the call. So we are looking for consortiums that will apply to make this concept a reality. And this concept is simple. So you see already the similarities with the previous infrastructure. Is a peer-to-peer infrastructure, no central services, no data storage centrally. It's a peer-to-peer. What it means that a data consumer, as you can see down here in the right, a data consumer, who is a data consumer? A researcher, a health professional, a public health authority, a regulator, an innovator / a company. If you like to have access to a data set because you want to do a research, you want to redesign policies, you want to actually have a data set to train your AI algorithm, you most likely you'll go to this health data authorization body in the country you are, so that you can have access. You say, I want to this research on COVID-19 vaccines efficiency, and I would like to see the adverse effects of vaccines in people with more than 65 years old, and that they had a diagnostic of cancer in the last 5 years. Imagine that you want to do that research. So you need to have real world evidence. And that real world evidence comes from electronic health records. So here at the bottom, health data registries, administrative data, claims data, genomics data. And this is how this health data authorization body will go. But imagine the following. We know that data is good, but we need data, more data and more data so that we can actually have representation. And what it happens is that imagine a world where you do this request to your country health data authorization body, but you have the means also to identify data sources in other countries, in other health data authorization bodies that could have data for your research project. In this scenario, what the health data authorization body from your country would forward your request to the other countries that may have data sources that would fit in your research project. So with one request, you as a data consumer, you could have access to data all around Europe. This infrastructure and this power should be made available to the European health level agencies like EMEA and ECDC that make most of their decisions and their policy making based on real world. So this is what is evidence-based decision making. But today they have really difficulties to get data to real world data, to get their hands on real world data. So we expect that this infrastructure can also facilitate their job in doing that. And we could not forget what we mentioned before, the already existing infrastructures out there that do very disease-specific brains, genomic, cancer, diabetes, eyes. So there are networks and registries specific for certain diseases. And they are not under the jurisdiction of a specific country because they are already European-wide repositories of data. So what we try to do, what we try to do is to make sure that this infrastructure is also able to connect them as nodes to the infrastructure. So this is the vision. Each one behind each country, each state infrastructure can be diverse, use different standards. This is how everything grows. But when you communicate with each other here in the European health data space, you should use the same standards, the same policies, the same rules, and the same legal basis. So that's what we are looking for here. And just to complete, last slide, where are we with the legal proposal here? So that's the path we started in the Q1 with the inception impact assessment, public consultation. Thank you if any of you is part of the hundreds that contributed with comments to that public consultation. We completed the impact assessment and we just recently submitted the EHDS, European Health Data Space proposal to the Regulatory Scrutiny Board. That's the next step, consulting the Regulatory Scrutiny Board to see if this proposal is accepted. Then we go for the European Data Protection Supervisor. And last but not least, in Q1 next year, we will hopefully come up, if everything goes right, we come up with a legal proposal from the Commission side to be discussed by the Parliament and the Council and everyone in Europe. I would love to answer to any questions that you may have today, and sorry if I took a bit longer than expected. Thank you very much.
Thank you, Licínio. So I hope you can listen to the applause here in the audience. I'm sure that in Zoom people are also reacting. It's good that we have the European health data space so well on track. Thank you also to the European Commission for the work you're doing. You thank Portugal, but also I think we in Portugal and all European countries, European Union countries have to thank you for the effort you're doing. And I'm sure that it's could be a good example also for Brazil, what we achieve here in terms of the European health data space. Okay, so right now we have a little bit delay in the schedule. So patience for a workshop participants will start in 15 minutes to leave time to conclude here the plenary. That's the advantage of global hybrid meetings. People are in Zoom, so you can wait a little bit, or if you can stay with us here in the main room, there's already a breakout set for the workshop. Without further ado, I call to the floor Miguel Coelho. Is oh, surprise, another Portuguese in an international role. Miguel, you want to address from here? Yes, that's fantastic. So this is your sticker, and without further ado, I pass it to Miguel Coelho, which is the Oracle Healthcare Director for South of Europe and Latin America. Thank you, Miguel.
All right. Good afternoon, everyone. And let's see. All right. So, good afternoon, everyone, and thank you again for your attendance of this event. A quick introduction perhaps about Oracle in healthcare before we go to the presentation in itself. I think everyone knows healthcare and associates, knows Oracle and associates Oracle with data and with databases, right? It's the immediate association, and probably also with some business applications and so on. But within Oracle, there are some specific, some vertical industry units, and healthcare is one of them, is one that is growing very fast, okay? So within this unit, we focus on solutions. We have a set of platforms, essentially for 4 purposes. The first purpose would be interoperability, so an interoperability platform that aims to facilitate exactly what Licínio was describing in the previous presentation, okay? The movement of data between entities, and we provide this platform to a few countries throughout the world, like Australia, Singapore, or for example, the cadastre of patients of the Brazil's unique health system, the SUS. Also runs on this on components of this platform. A second platform is for healthcare analytics. A third platform is for genomic data and supporting scenarios such as translational research and precision medicine. And the fourth one that, well, is a bit more recent, and due to this whole situation that we've been living for the last year and a half, which is our platform for pandemic response systems for population monitoring, disease surveillance, and vaccination registries, and so on. Okay, but yeah, moving back to the topic of this event, of whether the next generation of healthcare systems will be data-driven. Well, they have to be, right? I think the answer is a resounding yes. There's no doubt. The world is moving towards data and more data and more data. The healthcare sector moves a little bit slower than others, but yeah, this is the inevitable movement. So I'm not sure if we will see all these trends come to fruition in a year that starts with 2020 something. Perhaps it will require a bit more, but certainly what we can it's already clear is what we call today data in the healthcare space is very often only the clinical data about the medical care. But data in healthcare is much more than that, and it will be much more than that. And there are many more factors that influence healthcare of a person or a population. And those factors will need to be taken more and more into consideration, right? Not only the clinical data, but what's the genetic makeup of the patient, right? What are the social and environmental factors that may influence that patient's or that population's status and health state, and of course something that is more and more important, the individual behavior, right? Because that's a big influencer, of course, of the patient's own health. So we will need to move to this holistic view of the patient and their health. This holistic view will, of course, require many more types of data, larger quantities of data, because the idea will have to be, for us to manage all this, will have to be not to do sick care, or meaning taking care of people when they are sick, but actually doing well care, right? So preventing people from getting sick as much as possible, also to reduce the pressure on the health system. Then, of course, we will see also more and more adoption of precision medicine. You know, taking the clinical data of the patient together with their genetic makeup, having the ability to use all these characteristics, all these factors into account when deciding on the best course of treatment, right? And yeah, we will need more and more this to handle this amount of data, because we'll have an aging population that will accumulate comorbidities, that will accumulate diseases and simultaneous factors that will influence and make the clinical decisions more complicated. So yeah, if we really want to tackle all this and still keep in mind what these days everyone is discussing, this quadruple aim for healthcare systems, meaning offering a good patient experience, right? So that the patient really feels like they're being well taken care of, they are treated as humanly, as an individual, while keeping in control the per capita cost of those treatments that will only become more complex, of those situations that will only become more complex, but without also losing, you know, the perspective. Okay, these are the individual patients, but we need to look at the population health, right? What do we need to do at a more macro level to keep a good eye on the population that we have been tasked with protecting, right? Also a very difficult topic or difficult aim, to maintain clinician satisfaction. So the health professionals will be more and more, even more pressured than they are today. And it's for health systems, for health enterprises, maintaining this this workforce happy and empowered is extremely important, because this is also a very mobile set of resources, right? So if people, health professionals are in high demand, if they don't feel comfortable in a certain place, they can easily go to another place, and they will be very well received, because everyone is lacking enough resources. So we believe that indeed in the coming decades, data will only get larger and larger, bigger and bigger, right? It all started with some information about, especially in some countries, about claims, meaning about the services that you claim for reimbursement from health insurances, from your national health insurance fund, whatever. There is, of course, more and more data sitting in EMRs, but sometimes isolated in silos. There's more and more data now also coming in health information exchanges as the data starts flowing and being shared between the different participants in the healthcare ecosystem. there will be more and more data coming out of personal health records. So information that you contribute yourself, right? People are now wearing more and more, Apple Watches and smartphones and Fitbits and devices, personal devices that take that record some parameters, and this will start also contributing to this growth. Then we will need to start collecting more data on social factors, on environmental factors. So data that may be coming from other spaces that perhaps not only healthcare, social care, environmental information, weather information, anything. And this is going to contribute to further growth. And of course, when you start really going into the aspect of sequencing the genome of the patient, not only for more complex cases or for cancer scenarios, but even for more normal treatment courses. Of course, this data will grow even more, and and the growth of sensor data is of course also going to grow very quickly in the near future as more and more devices start to be connected. IoT platforms start pumping more information into this universe. Okay? So only a couple of examples of how data can be useful. This one from the NHS England. This was, I would say, a solution that paid for itself in a matter of a few months. The fact that there was the ability to collect this data, to join this data and look for unusual patterns of use was something that in just a matter of weeks allowed to detect fraudulent cases of dental services, dental practice that were being claimed that did not exactly to correspond to the truth. And I think for me more important, the ability to detect, for example, hotspots, more important to me because I think antibiotic abuse, let's say, or overprescription of antibiotics is a disaster waiting to happen. That will probably be worse than any pandemic if we don't put it under control. So the ability to detect where these hotspots where there was clearly an overprescription, clearly a pattern of unusual and higher prescription than normal, and the ability to go to these people that they were not ill-intentioned, right? But to go to these places where doctors would very easily prescribe antibiotics even when they were perhaps not needed, and to bring this a little bit under control is I believe a great benefit of such a solution. And again, a solution that is only possible if you have data, if you have good data, clean data to do this kind of analysis. My second example would be this is a solution that we've developed for the public health entity of the USA, the Centers for Disease Control and Prevention. And it's essentially a platform where you collect, where the citizens themselves can, via a website or an app, provide data about adverse or side effects of the vaccination, of the COVID vaccination that they have taken. Okay? And the fact that it was very easy for citizens to do this allowed us and the CDC to collect a tremendous amount of data that became all of a sudden extremely useful. Because, for example, during the clinical trials for the COVID vaccines, of course, no pregnant women had been recruited for the clinical trials because it's a very fragile group of people, a fragile cohort, right? That you don't immediately want to bring onto a trial of something that hasn't been experimented before. So they were left out. But the fact is that many pregnant women did indeed take the vaccine. Some because they didn't know that they were pregnant, and some because they knew, but they still thought it was worth the risk. And the collection of data from this platform called vSafe actually allowed the CDC to come to this conclusion that actually the vaccines are safe as well for pregnant women and the embryos. So, and this is a very useful result that hopefully will also result on the appropriate approval and hopefully again save lives. Again, the benefit of having data and being able to act on it to have insight on it. So yeah, I would just conclude with, let's say, the mission statement of our company that I believe applies extremely well to this industry and to what will hopefully be the next few years in terms of bringing data, healthcare, and other data together to help save lives. So yeah, our mission is to help people see data in new ways, discover insights, and unlock, well, new possibilities. If they're endless, even better. Okay. All right. Thank you. That was it from my side. Thank you.
Thank you so much, Miguel. Okay. So we are going to finalize the session. Thank you so much. And this is like closing the loop, because we have seen already that in Hospital das Clínicas in São Paulo, they have this strong collaboration with the NHS, and now we see that in an NHS case here. Last intervention from Eurodeputy Maria Manuel Leitão-Marques. She tried really hard to be here with us today and having dinner with us. Unfortunately, the challenges of the agenda of European Parliament member are not that easy, but she made this video for us. We are going to share now in the conclusions of this panel. A workshop will start in the end of this auditorium session. Be patient, participants, for the strategy workshop that will start next.
Good morning, everyone. Health is about to go through a disruptive transition. We need to anticipate and to manage it with the vision of those who know how to fly while keeping a foot in the ground to avoid crashing, as we say in Portuguese. As you are going to see during the next session, data are essential in this transition for preventive health, for the provision of health care, and more broadly, for the management of the entire health system. In order to have good quality data, we need rules on how to collect them, safe means of storing them, tools for their handling, and regulation to protect them. Moreover, we need all these procedures to be as transparent as possible, with information for and from everyone involved, in order to gain the trust of professionals and patients, of course. To succeed in this path, we need to combine many types of knowledge, experience, and skills. For sure, two of them will be knowledge and experience about health, and of course, knowledge about technology. We will have the privilege of having these two here with us today in the next session. There is no one better to talk about this challenge in Portugal than Katya Souza Pinto from the Shared Services of the Ministry of Health. They have many projects in order to organize our data space. We will also listen about the experience of a large hospital, the largest in Latin America, from António Pereira, who is its superintendent since 2014. Licínio Mano, who is the strategic advisor for EU cross-border health service at the European Commission, with expertise in the EU policy for health systems and service, is going to show us how to prepare this transformation in a cross-border way. I'm sure he is going to highlight the importance of interoperability, semantic and technical, so that we can benefit from a future European health data space. Jeannine, who is the CEO of ASCOM and President of the Strategic Board of Public Transport in Switzerland, will share with us her experience of managing big IT systems that are also under transformation. And finally, Miguel Coelho, who is the Healthcare Business Development Director at Oracle Health Science Global Business Unit, will bring to the table knowledge on technology and large experience on digital health, health information, and health care analytics. Have a good work and prepare yourselves for the questions.
This was a recording for the beginning, I'm sorry. But of course, it also is a useful way to summarize a little bit what we have just experienced and what we have seen here. Thank you all dear speakers that are remotely and in presence here. I think we couldn't have a better start for this summit. Is the quality and the depth of the ranges that were discussed and presented here today will be now object of discussions during the rest of the summit, as we are going to have, besides this plenary session, this is the first one in the afternoon. Now we are going to have a workshop on strategy foresight. So I kindly ask all the participants here that would like to attend the workshop to please find the hostess in the reception, and they will direct you to the room where we are going to have the interactive session with Dr. Jacqueline Conway on strategy foresight. So for the ones who are staying in a short minutes, we'll start another presentation here in the plenary with the global shapers. And we have technically 30 seconds for a bio break while we change the tables. Thank you so much. And again, a round of applause to our presenters here. Thank you. Short video, 30 minutes. We'll be watching here a short video while we prepare for the next session here in the plenary. And for Zoom participants and anyone wishing to attend the strategy workshop, please direct to the reception.
Welcome to the Tomorrow of Healthcare in the Oracle Cloud. A place where disruption is your reality and digital agility is the cost of entry. This is a world that rewards those who embrace bold ideas, fueled by intelligent data. This is a place where healthcare stays focused on caregiving, where health plans, hospitals, and health systems become active enablers, engaging patients as dynamic participants in their own wellness, where every aspect of the business of healthcare is orchestrated for organizations, intelligently automating, reducing human error, freeing you to progress your mission, where healthcare professionals are nurtured, developed, and given real-time feedback to help them better care for others, where operational excellence and people-first experiences meet clinical excellence, where administrators and caregivers work as one, intelligently and proactively gaining the insight to focus services and resources where they have the greatest impact. Take command of the digital age. The future of healthcare in the Oracle Cloud.
Pela família, pelos amigos, pelas férias, pelo futuro, pela sua saúde. Não adie mais o que ficou esquecido. Em 2020, quase 5 milhões de exames clínicos não Covid ficaram por fazer. Pela sua saúde, não adie mais os exames que o ajudam a cuidar de si. Unilabs, há uma química que nos une.
Sometimes it's hard to come home and act as if you didn't just witness something life-changing. Because you did. You were part of a critical moment in someone's life. And it makes me wonder, Why is this my choice? Why am I a nurse? I know I can't change the whole world, but I can change it for one person, even if it's only for an hour or two, by being there when it counts. Nursing is a process. Assess the patient, implement care plans, get the right people together. Heart rate 115, temperature 38.5, saturation 88. Could it be a surgical site infection?
Get infection parameters. I'll be there in 5.
And technology enables just that. Connect with the colleagues, access and share information, prevent documentation errors, stay by my patient's side. It means I can do a little bit more for my patients.
Hi, Michael. You have problems with your leg? Send him to ICU.
And I get to change their world.
Hang on, guys.
And I just know.
Thank you.
This is what I'm meant to do. That's why I'm a nurse.
Okay, thank you so much, Reggie, for the video now, and I'm relieved to see that it's already everything is in order as we are starting on track. Okay, so right now I have to call to the table present the speakers that will be addressing this plenary now, our global shapers and start fleet presentations. So if you're in the room, please join us, join me and this table. And again, as always, a round of applause for the persons who are attending in person. Valerie, welcome, and please have a seat here. A round of applause for Valerie, that's reaching us from Israel. We also have Dr. Steve McFeely, that is coming from Geneva, WHO. A round of applause, please. It is good to have physical presence, and it's important that we cherish that fact that we are sharing the same physical space. And I think from the global the shapers, we have the list complete here, and the physical presence would be kind enough to see if there's already the participants from the start field presentations. Are you here already? Yes, please, then come. Same thing, a round of applause for a start fleet presentation. Come to the table. Yes, that's okay. We have, it's much better than have empty cities that have everything here. And we have more like a circle for this presentations here. Ana também. Agora precisamos que sem uma cadeira. Okay, Starfleets. Okay, so yes, one Starfleet and then the other Starfleet presenter will come after we finish the global shapers because we don't have more seats in the table. Sorry, I was not aware of that thing. But now we have a complete table. Everything is in order, and we're going to have here a good session. I hope. Thank you so much also for all the participants that will be on the Zoom. And Drolis are with us, okay, also in the screen here. And also we have Marco Bego. Marco, welcome also on Zoom. We are seeing you on the plenary. Maybe it's you can have Zoom displayed here, so we can have all these challenges of the hybrid session and making sure that we are seeing each other also. Well, and Elaine Carey is also with us on Zoom. Elaine, Dr. Elaine Carey, welcome from Kenya. So good to have you on Zoom. Thank you so much. I'm not sure if Jennifer Regejo is going to contact. So this is why we can call this a Global Hybrid Summit, because with me also, oh, Jennifer, welcome, and it's good to see you here. So now we are in a perfect hybrid setup here, with the full table here in the auditorium, also beautiful mosaic of Zoom faces and presences. And also with me is Laurie Ringard from Canada, my co-host for this for this session on Global Shapers and Digital Health Portugal Starfleet presentations. We aim to do, in the end, a little bit of knowledge sharing, so that we don't be too much expositive kind of event, and also have some debate here with this fantastic group of participants that are here. So the Health Data Forum decided to